Many people believe cancer is on the increase now. It was not there before. But the truth of the matter is that way back when Albert Cook, is the first Western-trained doctor, came to Uganda, and he was based in Mengo. If you look at his records, which ended up at the medical school library, he described the cases of cancer in those days. Gentleman, a medical doctor by name Paul Carbon, had gone around Africa trying to look for places where the National Cancer Institute in the United States could collaborate. And in 1966, he had gone to West Africa, checked on a number of universities. He went to North Africa, checked on a number of universities. He went to South Africa, checked on a number of universities. He finally came to Makerere and he said, "I've found it." I've found it. And he was welcomed. And at that time, he suggested that the National Cancer Institute in the United States should work collaboratively with Makerere University. They agreed and signed a contract, a memorandum of understanding with the Department of Surgery of Makerere University to undertake research and training and treating children with Burkitt's lymphoma.
Dr. Ziegler was a man who did his training at Cornell University, Cornell Medical School, and worked extensively in Bellevue in New York. And he came down to the National Cancer Institute as part of a research team that was interested in Burkitt's lymphoma treatment. His mentor, his boss, Paul Carbone, said, you know, we have this standing collaboration, or we're trying to develop a collaboration between the American National Cancer Institute and Mulago Hospital, particularly the Makerere Department of Surgery. Would you be interested in the possibility of going and setting up an experimental treatment facility? John leapt at the opportunity.
The Lymphoma Treatment Center was very successful. And the success of this center led to the founding of a sister unit in 1969 called the Solid Tumor Center. The two units, the Lymphoma Treatment Center and the Solid Tumor Center, became what is now known as the Uganda Cancer Institute.
In terms of bringing patients to the unit, Ziegler and colleagues actually drove far up country with flyers showing images of Burkitt's lymphoma and saying, you know, if you are seeing any children with this condition, please refer them to the hospital. We'll give them bus vouchers, we'll give them food, and we will also give them treatment.
In the early days of the Cancer Institute was actually a recipient of the Lasker Award. And the Lasker Award is given, it's really thought of as one tier below the Nobel Prize. And this was some of the staff that John Ziegler, who was the first director of the Cancer Institute, got this award. And this was because of the trials that were done here. Uganda Cancer Institute was the first site of combination chemotherapy the world over. So that's groundbreaking research. But also, discovery of Burkitt's lymphoma was here at the Uganda Cancer Institute. The first use of chemotherapy for liver cancer was here, hepatocellular carcinoma was here at the Uganda Cancer Institute.
I joined the Uganda Cancer Institute in 1999 as a medical officer, special grade. At that time, the Uganda Cancer Institute had only one oncologist. So when I joined, I became the second doctor.
Over the years, I've contributed extensively to Kaposi sarcoma research, which is an HIV-associated cancer. We are describing the genetics of Kaposi sarcoma. We're describing the genetics of endemic Burkitt's lymphoma, which is the kind of Burkitt's lymphoma that we're seeing here. And very soon, we're also going to describe the molecular profile, the mutational profile of breast cancer in African women. So there's a lot of groundbreaking research that's happening here at the Institute.
Over time, we have developed a way of reviewing our patients and speaking to our patients and following up our patients. And so we have a cohort of patients, and they come from all over the country, some of them even across the borders. We have patients as far as Burundi, Rwanda, Democratic Republic of Congo. We have patients as far as Sudan.
Ideally, cancer is treated in 3 or 4 modalities. We have the surgery, because in the initial stages, we can move out that lesion by surgery. Then we can use the cancer drug, which is called chemotherapy, which is given inside your body through blood vessels, and at times you swallow them. Then we have radiotherapy, which uses beams of radioactive beams that act on the cancer cells.
When cancer is detected early, it cures. Because cancer is staged, stage 1, stage 2, stage 3, stage 4.
We have a program that runs every week. We screen for cervical and for all other cancers, breast and so on. And that runs every week from within.
1/3 of all cancers can be cured. 1/3 of all cancers can be treated with the view to prolonging life. And 1/3 can be treated with the view to making sure the patient is comfortable. Good palliation.
People usually don't think that government should actually work together with civil society. I think in an area like cancer, I would say that would be difficult because we have very little resources, and if the little resources that we have are divided, whereby civil society or private practitioners are doing their own thing, and then government is doing its own thing, these resources are going to be spread far too thin. So the best thing to do is to see how we can actually bring the expertise, the interest, the passion of everybody together, and then government just simply provides the framework how this can work out.
The Uganda Cancer Society was first established in 2011. Registered as a company limited by guarantee to provide basically charity services. It came about as a result of civil society, a number of organizations in there coming together to feel that they need an umbrella organization to better coordinate what they do in terms of cancer control. So it's actually a formulation of different member organizations coming together to form an umbrella organization that then will help to actually coordinate the kind of work they do for systematic response in the fight against cancer.
When we heard the stories that made the formation of UCCF, it clearly connected with me because it was clear that any action you made at that time to the foundation made an impact. And I want to thank the Uganda Cancer Institute, especially the leadership and the staff who started this initiative.
We are being a victim of our own success because with the fact that now we are getting the space for treating patients are there, the numbers of doctors are increasing, we have started creating awareness in the community, so people keep on coming. So we are a victim of our own success in a way. And that now inspired us to kind of do two things. One, to understand who are the people who are actually coming. And then secondly, to kind of come up with what can we do.
Management had planned to have centers, feeding centers to UCI, such that people who don't have transport can be treated there, and the oncologist can go there and review them. And we had that exercise started already. It is headed by Dr. Abrahams, then the nurse, it was me, and then the pharmacist. And we went to Mbarara, opened up a center, and it is running very well. We went to Arua, tried to open up a center, but human resource was a problem.
The decentralization is really a key thing, and it's important because Cancer Institute being central located, people move from all the 4 regions of the country to access service. But from the time we opened our clinic in Mbarara, we have about 1,700 patients who are attending the clinic in Mbarara. Those would be added to the number here. So we have a pharmacist who's trained in Mbarara, a doctor who's trained in Mbarara, so he can be able to do that I would do here. But now he can do it there and that's reduce the workload. If we open another branch in Bali, another in Gulu, another one in Arua as we're planning to, this will reduce first the workload here, but two, the human resource will all be distributed all around, other than having all ourselves here centrally located. It's important that we go where patients are, than patients coming to us, because then we catch them there early.
Cancer Institute it's been a work in progress, but it's had a very big impact on the community already. Like I mentioned, we have a catchment area of 8 to 11 million people. All these people are coming here and they can access care that they would have had to get only in Mulago. So that has helped in terms of patient adherence. We've also had patients who have been traveling to Mulago, but they are from the Western region and they've been transferred to get their care here. And it makes it easier for them to keep coming for treatment because the distance is shorter and they can afford to come as opposed to going to Kampala. It has also improved on sensitization of the community about the fact that there is cancer out there and people need to come for screening, people need to come for early treatment. It has been a very big benefit to the university because we have some students who are doing research here, postgraduate students, undergraduate students in different departments come to the unit and they can use the information that we have been collecting over the few years to come up with different research projects.
The Institute is now really set to take off, to take its place among world-renowned cancer centers, most obviously in Africa. I think if we are given a few more years, we are not going to have any rivals within the continent.
Some of the achievements we've made, we now have training programs to train cancer doctors, something we never had for many years, and that's a big achievement. We are the Center of Excellency in the region for oncology.
I see Uganda Cancer Institute as the best institute in providing cancer care in the whole East and Central Africa, and the best institute in providing research regarding cancer care. And this research will result into better care within the region. So we are working towards that.
We've tried to look for more resources through writing proposals to different partners, to government, to look for more funding. And some of those proposals and plans have been successful, which have brought in more resources to the institute.
The government has put up a 6-level cancer ward. None in the African region has a cancer ward that big. Okay. The government has put up, with the aid with Fred Hutchinson, we have a research center, again second to none. Now there's the East African Oncology Institute, and it's up and running.
Before we actually occupied this particular building, we used to face a lot of challenges with the space. Patients used to come, they used to linger and sleep outside the wards, because if one would come for treatment and the wards are full to capacity, we would used to have like 50% floor cases. We used to combine children and adults in one ward because of lack of space. So right now we have separated the children, they have their own ward.
I see the Institute in its current plan and strategy taking on more and more cutting-edge research and re-establishing itself as a research hub, not only in Africa but in the world for cancer care.
We are going to have the biggest radiation center possibly in Eastern Central Africa. By the end of all the construction, we will have 8 bunkers. Now that's bigger than any other center in the region in one place. And all these bunkers will have equipment. So training for radiation specialists will also be done here for this region.
There is a plan to set up infrastructure for a standalone cancer hospital in the region that will be facilitated by the Uganda Cancer Institute. And this is going to impact, of course, the different departments. And even at the level where we are, that we had already started to have impact in other departments. I chair a multidisciplinary committee that sits every 2 weeks to discuss new patients, and it means we sit with doctors from other departments. So capacity is growing in pathology department, in radiology department, in the surgery department, because cancer care is something you can't do as a lone soldier.
Uganda has been chosen as the regional training center for East Africa, Kenya, Uganda, Tanzania, Rwanda, and Burundi, training in oncology.
This regional center of excellence is supposed to promote training of cancer specialists, promote research, but importantly, all this must contribute to patient care. We want to reach a stage where all the cancer care that patients need, that people need, can be obtained here at the Uganda Cancer Institute. That is, we need to stop the medical tourism that's happening. You've heard of cases of patients going to India, patients going to South Africa, patients going to other countries. And our goal is that in the future, all the patients will be coming at the Uganda Cancer Institute. Now, of course, you can't stop people from going outside the country, but what we want to provide is the state-of-art cancer care so that nobody has need to visit other countries for cancer care. Whatever cancer care you need, it's available here at the Uganda Cancer Institute. And that really is the goal of the funding from the African Development Bank through the government of Uganda.
The future of the institute is very, very bright.